How does a neurosurgeon perform stroke clipping surgery? Imagine a tiny, delicate operation inside the brain that can prevent a life-threatening bleed. That's what aneurysm clipping surgery is all about. It's a precise procedure used to treat brain aneurysms that could cause hemorrhagic strokes if they rupture. The goal is to block off the aneurysm completely, so blood can no longer flow into it and cause bleeding. The surgery starts with the patient being put under general anesthesia, meaning they are fully asleep and unaware during the operation. The neurosurgeon then stabilizes the patient's head carefully to prevent any movement. Next, the surgeon cleans the scalp and makes a small incision, often behind the hairline or just above the eyebrow. This approach helps minimize visible scarring after healing. Once the skin is cut, the surgeon lifts the scalp and muscles away from the skull to expose the bone. Small holes are drilled into the skull using a high-precision drill, and a special saw called a craniotome is used to cut a tiny bone flap. This creates a small window in the skull, giving access to the brain. The bone flap is carefully removed and kept safe for later replacement. The next step involves opening the dura mater, which is the tough membrane covering the brain. With the help of an operating microscope and fine surgical tools, the neurosurgeon gently moves aside brain tissue to reach the aneurysm. Blood flow to the artery is temporarily controlled to reduce the risk of bleeding if the aneurysm ruptures during the procedure. If bleeding occurs, temporary clips can be placed on the parent artery to control it. Once the aneurysm is fully visible, the surgeon places a tiny metal clip across its neck, which is the base where it connects to the artery. This clip acts like a permanent seal, blocking blood from entering the aneurysm. Sometimes, more than one clip is used to ensure complete closure. The clip stays in place forever, effectively preventing future rupture. After confirming the aneurysm is sealed off, the surgeon closes the dura with stitches. The bone flap is then repositioned and secured with small metal plates and screws, which stay in place permanently. The scalp is finally stitched closed, completing the operation. The entire process usually takes between 3 and 5 hours, depending on how complex the aneurysm is. This surgery is highly effective for both unruptured and ruptured aneurysms, as it permanently isolates the aneurysm from blood flow. It's important to remember that if the aneurysm has already caused brain damage, some neurological symptoms might remain even after successful clipping. Recovery involves a hospital stay followed by several weeks of rest. Patients might feel tired or have headaches during recovery, but these symptoms usually improve over time. Every person's recovery is different, so it's essential to follow your doctor's advice and attend follow-up appointments. In summary, stroke clipping surgery involves a carefully planned opening of the skull, microsurgical exposure of the aneurysm, and the placement of a metal clip to prevent bleeding. This procedure remains a key treatment option for brain aneurysms, helping to prevent devastating strokes and save lives. Always consult a qualified neurosurgeon to discuss the best treatment options for individual cases.